When I have kids, I don't want to go to work to be with kids.
I hear that.
He's like, my goal is really for him to talk. And I'm like, some kids with autism don't even have the motivation to talk. They communicate differently, and we need to like enter their world and see like, how can we facilitate functional communication however they want to. When the parents are in denial, the progress is never going to be made.
So Sam, new job, SLP, you've always wanted to be in a hospital. What's been the difference between working private versus being in a hospital? And then also difference between adult and geriatric? Adult and adult and geriatric. Adult and pediatric.
I mean, it's really different. Like, I feel like you have so much more freedom when you're at a private practice. Like in a hospital, it's all about like productivity and hitting your numbers. Because at the end of the day, like, you're making the hospital money. Not like you're not making the private practice money, but you need to hit that quota every day.
I hear that.
So there's not really like any like downtime to like chill, I guess. Like, it's more just like you're there to work. But
Is it 12-hour shifts or 8?
It's 9.
No, okay, so
So I like the collaboration between like other like medical professionals, but like from a private practice setting, I miss like the intimacy of like a smaller group of people. Like, you have your speech team, like, which is true, but like everyone is so busy during the day that it's like hard to even like facilitate like meaningful interactions with like your coworkers rather than just having meaningful interactions with your patients.
Interesting.
Do you get meaningful interactions with your patients? Like, do you feel like it's a rewarding?
Now being under like the, you gotta hit the target and it's not more a connection.
I mean, like, there's like days where I'm like, okay, like I need to just survive and I need to like hit this number. But like, I'm always like trying to like make it enjoyable for everyone, especially like for like the pediatrics when the parents are in the room. Like, I always like prioritize like education. Like, how are they going to carry over what we're doing at home? Because like at the end of the day, like 2 30-minute sessions a week for a child isn't going to make so much progress. It's the carryover that makes progress. So like the education is more important. And like even in the hospital, like with the adults, like you want to make sure they're swallowing safely. But if there's family there, you want to say, okay, use these strategies at home. So when they leave here, they're not going to choke, they're not going to aspirate, and they're going to be okay. So like I always try to make it meaningful. I just feel like I'm running around with my head cut off sometimes.
From a ped standpoint, what was one of the main I wouldn't say difficulty, but you really had a hard time executing with families based on XYZ. Maybe they're not pronunciating, we're not improving on this. Like, what was your number one obstacle within the peds?
Yeah, but that's the thing in the medical setting. It's not just articulation and language. She's doing
so
like,
what was one of
educate him. He has
like,
no idea.
I mean, sometimes like the parents are, the biggest thing with parents, especially with kids that have like diagnoses like autism, Down syndrome, things like that, it's like the in denial. It's like when the parents are in denial, the progress is never going to be made. Like, you need to be like, okay, my child is 4. He's not talking. Like, you need to get over that bridge and be like, okay, like maybe he can talk with a device or using gestures. Like, he may not be verbal. Like, we'll try. But once you can like acknowledge that, then that's where the progress
expand
happens.
on that. Like, I feel like you really need to drive home with
Like-
parents who
like
are in denial. I was a bit in denial. I wouldn't say I wasn't in denial, but I'm like, hey, does she really need speech? I'm like, does she? Yeah.
But Brooklyn is, she mastered it in 3 months, guys.
Why not? Earlier is the better. Earlier
I just didn't think that it was
Intervention.
it was like I thought she was okay.
But did you notice an improvement?
Of course, she now says words right. Yes.
Apparently, whatever. So drive it in parents.
So like, for example, like I had an evaluation last week and I kept saying like, does this child like have autism? And they were like, the dad was like, yeah, the doctor said that. And I'm like, so does he have a formal diagnosis? And the parent kept saying, the doctor said that. I'm like, so does he have a medical diagnosis of autism? And finally he said yes. And then he's like, yeah, like at home, he's pulling me to get things, like grabbing my hand to get things. And I'm like, well, that's a red flag. Like, I know that that's his way of communicating to you, but like that is a sign of autism. He's like, my goal is really for him to talk. And I'm like, some kids with autism don't even have the motivation to talk. Like, they communicate differently, and we need to like enter their world and see like, how can we facilitate functional communication however they want to. And then once the parents are more accepting, that's where like the growth really happens. If you're in denial and you think your child's just magically going to talk because they're getting speech therapy. Like, that's the biggest myth ever. Like, putting your child in speech therapy because you want your kid to talk. Yeah, we can help you, but it's not like magic. It might take months. It might take years for your kid to talk. So,
and if there's a neurological condition, it's just probably is going to not happen.
yeah, and they need to be more accepting of like other ways to communicate. Like, some people like don't even, that are like in wheelchairs or like have like tubes down their throat, they can't talk at all. So they should be grateful that their kid's even walking around with a healthy mouth, that they can even make sounds. So it's like finding the silver lining in all of it.
So then on the flip side, what do you see with adults? Is it the person that is like, I can't believe this is happening to me right now? Yeah.
A lot of like, if they like, for example, we have a lot of like stroke patients, and if they're like cognizant enough to know like, oh my God, yesterday I was fine and today I'm like this, it's really sad.
So that's what stunts their growth.
They're grieving themselves.
I mean, yeah, they're grieving.
Yeah, because then you'll ask them a simple question like, point to the door, and then they'll point at the table, and they're like, no, I'm pointing at the door. And I'm like, no, like, this is the door and this is the table. Like, you have to like break things down for them. And like, sometimes it's hard because like you're talking to them like they're in kindergarten, but that's where their brain is in this moment. So you just have to always enter their worlds.
So you had different tools with the kids, and you obviously probably it's a counter-transference a little bit with the adults. Are they the same strategy? You would say once a man, twice a child. Is it the same thing? Not necessarily from a swollen standpoint, but
it's different because like one of them is like
it?
habilitative. Like the kids are like building communication, and for adults it's rehabilitative. So you're trying to bring back skills.
Oh.
So like it's
building versus bringing back. Yeah, because what are the typical points of injury for
really
adults that lead to that deficit?
I didn't even think about it like
strokes, heart attack, kidney disease, dementia, also.
Okay, I have to say, I did not know about heart attack and kidney disease. Those can be contributing factors.
Well, kidney disease, think about it, like, so when adults get a UTI, they go a little bit delulu.
Exactly, yeah. So that's actually that's totally my field.
That,
I see that.
Wow.
There's two things that would kill a geriatric. UTI that puts them into a whirlwind. Or a broken hip.
Yeah.
Wow.
If you have two of those things.
So somebody break it down for me, because like, why? Is it like just what's released when you have a UTI that can just be like poisonous?
It's like
you're delirious.
If you're delirious.
Yeah,
I don't know. Really? It just happens like in adult.
Really,
like it's different when we have a UTI.
Yeah.
Like if we get a UTI, like it burns or we go to CVS.
It goes to their brain, I feel like.
Yeah, it does.
And it
literally causes like straight delirium.
Yeah.
So that impacts their speech.
It impacts like everything. Like sometimes it's just like a decline. Like they don't want to talk anymore. They don't want to eat anymore.
Depression hits in, the whole 9 years.
No, that's what's going to take me out. Because I used to get UTIs all the time.
Yeah, but
that's
but the UTIs are normally correlated to poor diet.
Dehydration.
Dehydration. Not drinking enough because they don't like to drink water in general.
Yeah.
So it's really
is a result of poor diet. Adults with dementia or like memory problems get UTIs because they forget to drink, they forget to eat. So it's like all these things are happening and they're all related, even
they're
though
all compounded.
They seem so far apart.
And even like he was saying, like a hip injury, like when you go into the hospital, like it's possible that you're just going to straight decline, even if it's not related to your brain, because you're going to get depressed. You're like,
that's why when I have my participants or residents, I try to get them out of the hospital as fast as possible because that's my money. Like they decline so fast. At the end of the day, it's another number for the hospital.
Exactly.
So that's wild. So it's really different. So you said rehabilitated?
Yeah, so like kids, it's like habilitative, where you're teaching them how to do something, and rehabilitative, you're reteaching. So it's versus like the first time you're learning something versus like relearning it.
So this field you're in is very interesting, very helpful. I feel like it takes a certain type of person. So that being said, for like our listeners that are around your age or younger that are thinking like, is this career for me? Should I go and kind of go into this industry? Like, are there any like personality traits you think are equipped to have that person do your job? Or you think there's like certain interests that somebody should have? Like, because I feel like when I was young, I used to think like, do I have like what it takes to be happy there or be successful there? And I would try to on my own kind of compare my traits and my interests and experiences to them. But I wish somebody kind of was like, if you're A, B, C, D, this might be a good fit for you. Do you have any advice for them?
I think that if you're like independent, can problem solve, and like have empathy, you're perfect for a hospital setting. But if you're somebody that needs like constant support and like reassurance from like a superior, or just more like intimacy, like emotional intimacy with like your coworkers, just like having conversations, and you need to be like in a private practice.
But I think were you asking more on the SLP side as to, or
No, both. I mean, whatever she
Okay,
sees fit,
so-
but like definitely the hospital setting, because at least all the SLPs I know, they're either in schools or they're in private
The
practices.
hospital setting is like grueling, because like sometimes you'll have a patient that like will really make you upset. But I feel like I kind of don't get upset anymore. I feel like I'm like numb.
ooh, are you getting burnt already?
I mean, I feel like I was burnt out before I even started this job.
Got it. Okay.
But I love it. I do love like the hospital setting, and like I want to grow in this setting, but burnout is real. There are some days that I'm like, I don't want to treat.
Oh,
But like you just have to do your best, because they're coming for therapy, or like they need you, or like
Do they show up like for private pay? They show up because they're paying for it and they want to see the benefits. And
Yeah.
do they show up to therapy?
well, are they always inpatient
So
already?
the adults are inpatient. It's like
Oh, okay.
acute care, and
Got
the pediatrics are outpatient.
So you're dealing with both right now?
Yeah,
Oh wow.
but it's all in the
That's what
hospital.
she wanted to do. That's why she went to that setting.
Oh.
To be able to have like quite a variety of lifespan.
Yeah, which is nice. I like the variety, but I definitely like adults more.
I get it.
Really?
I love kids. I love hanging out with kids.
That's what's so weird. She's so great with kids. So great. But yet I totally get like your day to day.
I don't want to work with them anymore. I want my day-to-day to just be adults.
Yeah. And then enjoy hanging out with kids when you have fun.
Yeah.
And enjoy the kids.
Like when I have kids. Like
Yeah.
when I have kids, I don't want to go to work to be with kids.
I hear that.
Yeah.
I preach. That's why it took us a
Amen.
long time for us to have kids. No, really, because we talked about it.
Yo, we were on the Dinks list for the longest time. You know what Dinks list is?
No.
I don't. What's happening?
Dual income, no kids.
Oh my God. Wait, hold on.
on.
Let's check it. Dual. Yeah, you're lucky.
Did your dysgraphia work out?
Do you know the difference?
Dyslexia is the reading and dysgraphia is writing.
Yeah.
Crap. Great. Oh, yeah. Good God. He's masters now. We just honorary masters. All right. So, any last words of wisdom for those that are about to go into graduate school and thinking, oh my gosh, do I turn around? Do I stop? Do I have what it takes?
I think you need to find a good mentor, like going into grad school, because grad school sucks. Like there's no way to sugarcoat it. Like it's the worst 3 years of your life. And it's true. And I actually wish someone told me that.
There you go.
I actually wish someone said, like, be ready to not be your happiest self for the next 3 years, but it will be worth it. And it is worth it, but those 3 years, like, it's not fun. You're doing it because, like, you have an end goal. Like, the process isn't fun, but there is, the light is at the end of the tunnel.
On everything that's worth working for.
Yes, but she says something interesting. Not everybody's built for that. Like some people truly have a blind spot to agreeing to suffrage, seeing the light in the tunnel. Some people cannot kind of delay gratification.
No.
So like if you aren't that person, going to graduate school not for you, because it's a long time of you taking sacrifice and taking that to then get something. But was it worth it?
Yes. Okay. But I do wish someone told me that it's gonna suck.
Okay, hear that, everybody? Graduate school sucks.
It does, but it's worth it. Like
it's
for your career goals, it's worth it.
And look, 3 years, but then guess what? Now you have a lifetime to reap the benefits
is there
and have so much
any-
flexibility to do whatever you want.
Yeah.
Is there like so you know how you have your psychologist and neuropsychologist? Is there any upper echelon in speech?
Like additional certifications
Yeah,
and things
there's
like
a
that?
lot. There's a lot of
Like
additional
what?
like specialties. Like if you want to be a NICU SLP, you could get certified in that. Like board certified in swallowing. Like
Oh jeez.
you can like
Oh my God.
there's different certifications. Oh my God, he's ridiculous.
Kids watch this shit.
But you can work your way up like a clinical ladder. He's so ridiculous.
Like, subscribe, comment, forward.
How do you get board certified in swallowing?
I don't know how I went sour that fast. I really don't.
So are you looking to?
I mean, like, we'll see what happens. Maybe when I'm not working with kids anymore, I'll, like, think about it more. But, like, right now, I'm actually still so burnt out from grad school that I can't think about.
You just started.
yeah,
like, you just
yeah,
want to
you're
settle
right.
in and enjoy this for a while.
Yeah.
And just find your own pace and your schedule. And that's what you're doing. I love it. You're living the dream, but you're also like living what you're preaching to other people.
Yeah.
Like find the space, find the mental health, put up your boundaries.
Seriously, mental health is like so important. Like sometimes I'm like, fuck physical health. Like my mind is more important. I'm like, if my mind isn't working, like I'm not
That's
gonna
what I
do
keep
shit.
telling the people. I'm like, bro, your brain talks to everything else. So how the brain? I said I wanted to start like this whole meme thing, like brain health. But Lauren's like, oh, brain health with organs and so forth. I'm like, yo, you remember we were talking to Gia about it, and you're like, you don't want to like alienate brain because.
No, I was just saying that in my field, there's an appreciation for the brain as a structural organism and the mind as like a conceptual entity of consciousness. They're different. So the mind is different than the brain. But we do know that the brain and body communicate, and what people we've now kind of recently discovered in our generation that our body actually talks to our brain too. That's where gut health.
Yeah.
Our bacteria actually release things that talk to our brain.
That's a cool episode idea.
And I feel like
diet is
diet.
insane with what we know now communicates to our brain.
Did you always have this brain health, mind body kind of like?
Not until grad school when I was literally depressed.
Oh wow.
And that's when I started my anxiety meds. And I was like, oh my God, like I actually need help. I had like debilitating anxiety where I was like, I can't get out of bed. Like that's how anxious I was. And I would like force myself to go to sleep.
And
just it's so real.
It's so real.
And I'm so happy that you sought out the help you needed without any kind of like stigma or other people giving their opinions. Like, I'm happy you're like, this is not
You've said in previous episodes that you take meds also.
I love my anxiety meds.
Oh God.
We swear by it.
No. I love it. Now
she's not drug induced at all, guys.
Oh my God. No. My patients and the families know that I'm not like pro meds at AK, like it's the first line of defense. Like, oh, you're having this and this, meds. No, it's not the first line. But I am also very pro, like if you're at that limit where you're like, I'm not healthy and I'm not okay, and there's a resource, that's much better than like becoming suicidal or failing out of school or losing your marriage. Yeah. Like take the pill.
How does Alistair take mental health?
He takes it seriously, but I don't think he would ever be medicated for it. Like he like loves like going for a walk or going in the pool or the hot tub or the sauna or the steam room, like that the what's it called? The cold plunge, like things like that are good for his mental health, or like building shit. He likes to be busy and that calms him down. Like we were at dinner last night and I was like, oh my God, thank God tomorrow's Saturday, like blah, blah, blah. And he's like, yeah, babe, I have so many things to do. And I was like what? And he like lists the whole thing and he was like, but that's relaxing to me.
Oh yeah.
And I was like, okay. Cause like for me, rotting on the couch is relaxing, but for him, that makes him anxious.
Oh my God.
I can't wait to rot on the couch tonight. I started a new show. I'm into it. I'm loving it.
What show?
What is it? High Potential?
Oh.
Is that what it's called? High Potential?
I don't remember.
Did you watch Hunting Wives?
Yes. Okay. If I hear it one more time that I look at that lady, I swear to God.
Oh my God, that's hilarious.
Who's
Margot.
Lauren's Margot.
Everyone's like, you're Margot. I'm like,
You kind of have her like sexy demeanor.
Oh
though.
crap! See, that's the point.
She's like that. She's that.
It's like seductive.
She's that MILF. Really.
All right.
Lauren is a MILF.
Wow, when did that day happen? I remember when I was like 16, flashback, and now I'm that. Okay, anyway, it is time to wrap up. That face is scary. Like, subscribe, comment, follow. Don't think I have anything else. No. Ask Miss Sam, she would know. Thank you for listening. Check us out next week.
And Lauren's a MILF.
Period.
Oh my God, we're cutting that out.